Welcome to the 2020 South Carolina Telehealth Summit, our very first virtual summit, and we hope you enjoy yourself and we hope that you learn a lot. And now I'd like to pass you over to Dr. Jimmy McElligott, a pediatrician at MUSC, who co-chairs the South Carolina Telehealth Alliance with me, and he is going to give you a state of telehealth in South Carolina.
You know, entering into 2020 in January and February, we felt that we were at a real pivotal point for telehealth. We had achieved a ton. We initially started a strategic plan for the state back in 2014. We had completed 5, now 6 years of that plan. We were looking to reorganize our plan and focus even more going into the next decade. And there's a lot to be proud of. There's a lot to talk about that I hope you hear about here at the summit. I'll make some highlights, and this is all talking pre-pandemic because the conversation changed in March. But pre-pandemic, the things that have happened over the past 5 years are truly remarkable. I think if we went back to 2014 and looked at our plan, we've overperformed. We've done amazing. We have telehealth connections in every single county of our state. We have 46 counties and 500 connections. We are dense providers of telehealth. We're covering most of the health professional shortage areas for access to care. We have school-based care covering many school districts across the state in the most underserved areas. Many people who've been following the telehealth progress over the last few years do realize that early on we were aggressive about, through partnership, covering the state for telehealth, for telestroke and specifically. But most people might not know that we have strong evidence saying now that almost every stroke outcome is improved when you have telestroke in your county. That includes mortality. So that specifically means that when you got telestroke brought into your county in partnership between the hospitals, you are more likely to survive a stroke. And that's a great thing for our citizens. Similarly, for our tele-ICU programs, now growing as well, your likelihood of dying is less in these ICUs. We are saving north of 200 lives a year, judging by the numbers. And it's amazing that we would be saying these true outcomes. For the school-based program, another champion program that has really been a collaboration of multiple health systems throughout the half a decade we've been working, you know, where we're most robustly placed, when we have every school and when we have the school nurses engaged and we're doing everything we can, we are dropping emergency room visits for asthma by 1/3. We're doing amazing things. The Department of Mental Health alone is covering a majority of hospitals in the state with emergency room consultations. When they do a consultation, the numbers say that we save at least $1,000 every time to the health system, and they are doing thousands and thousands of consultations a year. So I hope we get the chance to dive into these numbers. I hope we get to celebrate the progress that we made. And I hope we take a moment and plan for the future and what more when we do. But the pandemic hit and things changed. Not many people know. Everybody knows that telehealth has been used. Hopefully this conference is much bigger and hopefully everyone's engaged. The opportunities are wonderful. The payers have been great coming to the table and enabling all of this. Nobody saw this coming and it's been truly revolutionary. Nobody wants the pandemic. But if there is a silver lining, we're learning how to bring care to people directly and quicker. So there's much to unpack with that and much in our discussions to have this time. So I'll just say some of the numbers reporting just from the South Carolina Telehealth Alliance partners, not including everyone in the state, between January and June, 1.3 million telehealth visits occurred in our state alone. That's the scope of what we're talking about, and that's the scope of change that we're talking about. During this time period, we should also understand that it's been a huge effort on broadband. Palmetto Care Connections has really led the way, made our state a leader in the country in being able to leverage federal subsidies to lower the cost of internet for healthcare providers. And millions of dollars per year in subsidy are brought into our state through that mechanism. Going forward, we will need to focus on the gaps in digital literacy, in access to broadband, and we do not want to be exacerbating healthcare disparities because only those with the means can tap into telehealth going forward. But that's the scope and that's the new challenge and the new problem that we get to tackle. So I'm excited to be opening the 2020 South Carolina Telehealth Summit. There's just so much to talk about. And thank you.
Thank you, Jimmy, for the update. Good morning and welcome to the 8th Annual Telehealth Summit of South Carolina, and again, our first ever virtual summit. Over the next 2 Fridays, we will hear from exceptional state and national speakers who will present current telehealth information and relate it to these unprecedented times of the COVID-19 pandemic. Some of the many highlights of this summit include our 4 keynote speakers. We will hear from Brendan Carr, the FCC Commissioner, best-selling author and international speaker Anton Gunn, Dr. Judd Hollander, Thomas Jefferson University's Senior Vice President for Healthcare Delivery Innovation, and Dr. Nick Patel, Prisma Health's Chief Digital Executive. Panel discussions will include a dialogue with national and state legislators on telehealth and broadband, as well as conversations with rural providers who have advanced care coordination with telehealth during COVID-19. In addition to plenary sessions, 4 breakout sessions will be presented each day with a variety of topics related to business, technology, or clinical categories. I would like to thank all of our sponsors individually for their contributions. Our diamond sponsors are Blue Cross and Blue Shield of South Carolina and the South Carolina Telehealth Alliance. Our platinum sponsors are McElligott Health, the Medical University of South Carolina, Prisma Health, South Carolina Department of Mental Health, and the South Carolina Department of Health and Human Services. Our 2 gold sponsors, Healthy Me, Healthy South Carolina, which is a program of Clemson University, and the University of South Carolina School of Medicine. Thanks to these sponsors, this year's summit was offered free of charge to exhibitors and attendees. I encourage you to visit the sponsor exhibit pages linked to their logos on the home page, as well as the virtual exhibit booths. In addition to our 9 sponsors, we are pleased to showcase 23 exhibitors this year. I hope that you will find this virtual summit platform easy to use, informative, and a lot of fun. After each presentation, there's a 15-minute break when you can view the poster presentations, rate your favorite poster, visit our virtual sponsor and exhibit booths, visit the Ask the Expert room, and find answers to your questions related to telehealth reimbursement, policy, technology, and broadband questions. Or check out the break room for relaxing music, funny videos, best stretch practices, and much more. Everywhere you click on the Summit site, you will earn points in the 2020 Summit Virtual Challenge, making you eligible to win a prize at the end of each day. For a list of activities and their point values, please click on the game link on the menu bar or on the quick links. The leaderboard found on that page tracks each attendee's points. Prize winners will be announced at the end of each day. I would like to thank the Summit Planning Committee members for their input and assistance all year long in organizing this virtual event. Dr. Ahuja of USC School of Medicine, Jennifer Bailey of South Carolina AHEC, Stuart Cooner of South Carolina Department of Mental Health, Karen Driggers of Prisma Health, Reagan DeBose Morris of MUSC, Dr. Rick Foster of the Alliance for a Healthier South Carolina, Sonia Frankowski and Ryan Cruz, both of the South Carolina Telehealth Alliance, Chris Mosley of McElligott Health, Jessica Seal of the South Carolina Office of Rural Health, Lloyd Sermons of the Southeastern Telehealth Resource Center, and our very own Davia Smith and Kathy Rode of Palmetto Care Connections. Lastly, a quick thank you to the entire Palmetto Care Connections team, Matt Hyatt, Davia Smith, Kathy Rode, Ramona Midkiff, Ethan Kemp, and Scott Moody. This virtual event could not have been put on without the PCC team, and I really do want to thank them. Thank you all for attending the 2020 South Carolina Telehealth Summit. We appreciate you being here with us. Thank you.
Hi, I'm Davia Smith, Director of Education at Palmetto Care Connections, and I'll be your tour guide of the 2020 Virtual Telehealth Summit platform. To participate in the summit, register for free at palmettocareconnections.org. PCC will send you an invitation to edit your profile on the virtual platform. The platform will prompt you to create a username and password. Let's take a look at the home page. Here you can see our sponsors, keynote speakers, 3 reasons to attend the summit, SCETV telehealth videos, and quick links to popular pages on the platform. Located at the top of the page is the menu bar. To view the summit schedule and join a session, click Schedule, then Agenda. You can view the agenda in List View or Calendar View. You can export it, and you can print it. To customize your schedule, select the plus signs beside the sessions. To view your customized schedule, go to View My Agenda, or on the menu bar, My Agenda. To join a session, click the session title. A video will appear on the left when the countdown is complete. Click Play to watch the presentation. At any time during the presentation, use the chat box to ask the speaker a question. Use the Polls tab to answer any questions the speaker have for you. Select People to see who's in the session, and select Files to download the presentation. To view speakers and attendees, select People on the menu bar. You can view their profile, send a message, or schedule a meeting. You can also export a list of all attendees, including speakers, sponsors, and exhibitors, by selecting the Export People list. Before, between, and after sessions, visit our sponsors and exhibitors. On the sponsors page, click Learn More to visit our sponsors' virtual trade show booths. On the virtual trade show booth page, attendees may request more information, start a discussion, download any files, view the sponsor's description, click any links, and enter the virtual trade show booth. Our exhibitors page is very similar. Select an exhibitor. You may request information here, start a conversation, download any files, watch videos, click any links, view their description, and enter the virtual trade show booth for a live meeting. Another activity you can do during your breaks is view the 2020 Virtual Telehealth Summit posters. Click Go to Poster Presentation to view each individual poster. Ask a question about the poster or leave a comment. Download a copy of the poster and watch the poster's research flash video. Also, be sure to vote for the poster. At the end of the summit, PCC will recognize the Programmatic Award winner, Scientific Award winner, and People's Choice Award winner. Do you have any specific questions about telehealth? If so, ask the expert. There are 4 category topics on the Ask the Expert page, where attendees can ask any question they may have and an expert will respond. Let's check out the virtual break room for the ultimate break experience. Listen to music, watch inspirational videos, watch funny videos, scroll down to see relaxing videos, stretch videos, or take fun tests. Now for the moment you've all been waiting for, how to play the virtual telehealth summit game. At the end of each of the 3 days of the summit, PCC will award a prize to the top 2 attendees on the leaderboard. To earn points, check out the list of activities. Every time you join a virtual trade show, you'll earn 500 points. Every time you watch a session, you'll earn 500 points. If there is a tie, a drawing will take place. Prizes are listed at the top of the page. The game begins on October 9th and will end on October 23rd. Points will reset each day of the summit. Private messages will appear in your inbox. To edit your profile, click Account. If you have any notifications, they will appear here with the bell sign. If you have any questions about the summit, visit the Frequently Asked Questions page, or for questions about the platform, select Support under Account. You can also contact me by email at davias@palmettocareconnections.org. Thank you for joining us. We hope you have a great virtual telehealth summit experience.